it's really important. I believe it's really important for patients to see diversity. And do you feel like a more diverse population of clinicians would be able to allow for better health outcomes within physical therapy or perhaps other healthcare spaces?
Yeah, it's tricky because I think as PTs, we love quoting research and evidence and sort of backing up these statements with facts and objective data. And so I sometimes at conferences I'm seeking out these sessions where I have my bias in the information that I'm looking for in the studies, which is there's a disparity in outcomes. Patient satisfaction scores are lower if there's discordance between the provider and the patient. There's not much out there, believe it or not, that either that corroborates that story. But there's not that much research anyway about this specifically.
Mm.
So it's tricky. It's sort of anecdotal. I think it's all based on all of our experiences, and what patients have said to me is you're the first therapist who's ever listened to what I'm saying. That could as well be for a white male PT. It doesn't necessarily, even if it's a Black female patient telling me this, can we attribute that directly to race? Maybe, maybe not.
Right.
It's something that I find is probably difficult to measure. It's hard to get rid of bias, even in studies like that, because you're looking for confirmation bias. You want to see what you're expecting, and so the outcomes, we should probably just continue to look into this. I want to believe that there may be a little bit of a difference based on either race or gender or some other category, but I can't say it with confidence because, again, there's not much to kind of back up that statement, but I think we're all aware of it now. So it could be an area to look into.
Yeah, I can't imagine trying to be a researcher trying to identify or get like actual objective data to be like, this is actually happening, or, and trying to figure out, and you're getting funding for this too. So you got to make sure that you're using resources in an adequate way. So that way you can actually prove what you're actually doing.
Yeah.
And on the topic of patients, are there also health disparities within minority communities, and maybe a more diverse healthcare workers could help to aid these? I know we discussed that perhaps it's difficult to see, what type of health disparities exist within minority communities?
Yeah, that's a big question, as you know, Mike. That has a big response, but the one that jumps out at me is, we can look at mortality rates, right? Like it's not so much that this group are more likely to die from a certain disease or disorder, or it's the screening, it's the assessing, it's listening to the patient. I think that when we look at this, some of the systems, the disparities are almost built into the healthcare system, so it makes it a little bit harder to identify specifically where this disparity is birthed. So, we look at normative values, right? I learned very recently from a colleague that the data that healthcare workers use to identify when someone is maybe appropriate for treatment or when the insurance company will actually reimburse for a certain treatment, there's bias within those normative values. And so that's a little bit scary, because where do we begin? We need to reestablish normative values, right? That is no simple task.
Yeah.
Yeah. So, it's easy to kind of make a general statement about the disparities, but looking into how to really dive into them and identify where it would make the most sense to direct our efforts in the healthcare system, I think that would be key.